Hello everyone, this is Dr. Sultan Moinuddin Shaukat Ali. I have completed my MBBS, MD and DNB in radio diagnosis, alumni of State GSMC and KEM Hospital, Mumbai. In this today's session, we are here to discuss about a special topic which is ultrasound features of diffuse thyroid diseases. Just in my previous session, I have discussed one of my one of diffuse thyroid disease. Okay, so in this session we are going to see continuation of what we had seen in that session. So in that we saw about Hashimoto's thyroiditis, right? So it's an autoimmune form of thyroiditis. Again in this session we are going to see about one of the very important autoimmune thyroid disorder, and it is one of the diffuse thyroid illness. Okay, so then I'll be starting with very basic fundamentals so that things are very easy to understand. So here first we'll be starting with a special disease which is Graves disease. Okay, Graves disease. Graves disease. Now you already know the basics that this is a thyroid gland with left lobe, isthmus and right lobe. Thyroid gland secretes T3 and T4. T4 is thyroxine, right? And both of this secretion, that is secretions of thyroid gland, is under the control of pituitary gland, which secretes TSH, thyroid stimulating hormone, and this stimulates the release of T3 and T4. बराबर, ये बात हमें समझ में आई थी, ये हमने लास्ट सेशन में भी देखा था। T3 and T4 जब रिलीज होते हैं तो ये बाय नेगेटिव फीडबैक inhibits TSH. So there is a negative feedback mechanism by which TSH is inhibited. The release of TSH is inhibited from pituitary. That is by negative feedback mechanism. Okay. Now, what happens in Graves disease? So, in Graves disease, there are special autoantibodies. It's an autoimmune disease. Okay. Again, what is autoimmune disease? मैंने ये आपको आखिरी लेक्चर में भी बताया था कि autoimmune diseases are those disease जिसमें बॉडी की इम्यूनिटी अपने खुद के सेल्स को डैमेज करती है। नॉर्मल इम्यूनिटी का काम होता है हमें ज्यादा ताकत देना, हमें डिजीजेस को अवॉइड करना, डिजीज रेजिस्टेंस पैदा करना, बट समटाइम्स बॉडी माइट डेवलप सम डिफेक्टिव मैकेनिज्म्स थ्रू विच ऑटो इम्यून डिजीजेस अकर। इसमें स्पेशल तरह के एंटीबॉडीज बनते हैं। सो देयर आर स्पेशल एंटीबॉडीज आर फॉर्म इन दिस डिजीज एंड दिस एंटीबॉडीज एक्ट ऑन थायराइड ग्लैंड। अब कमाल की बात यह है, सो फंडामेंटल समझ में आ गया कि थायराइड ग्लैंड टीएसएच जब भी बढ़ेगा T3 T4 रिलीज बढ़ेगा, ये हमें पता है। ऑटो इम्यून डिजीज है ग्रेव्स डिजीज जिसके अंदर वी हैव एंटीबॉडीज अगेंस्ट थायराइड। नाउ व्हाट हैपेंस इज दैट, रिमेंबर टीएसएच जब भी बढ़ेगा T3 T4 रिलीज विल इंक्रीज, करेक्ट? दिस इज व्हाट हैपेंस नॉर्मली। अब कमाल की बात यह है, द इंटरेस्टिंग थिंग इज दैट these antibodies which are present in Graves disease, they have structure which is similar to that of TSH. The structure of this antibody is similar to TSH. तो जब ये antibodies bind होते हैं thyroid पे, so when these antibodies they bind to thyroid, okay, they just look like TSH, they behave like TSH. So thyroid thinks that this is TSH which is increasing and not the antibodies. So because of this antibodies which are just like TSH, there is increase in T3 T4 level. This is exactly reverse of what was happening in Hashimoto. हाशिमोटो के अंदर एंटीबॉडीज बनती थी जो थायराइड को डिस्ट्रॉय करती थी। यहाँ पे जो एंटीबॉडीज है वो थायराइड पे बाइंड होके दे आर बिहेविंग लाइक टीएसएच, बिहेवियर इज लाइक टीएसएच। अब टीएसएच बढ़ेगा तो T3 T4 बढ़ता है, तो एंटीबॉडीज आर बिहेविंग लाइक टीएसएच, hence T3 T4 is increasing, and as T3 and T4 are increasing, this behaves like hyperthyroidism. There is hyperthyroidism. And on biochemical investigation, what will you get? You will get that T3 is high, T4 is also high. And if you do TSH levels, TSH level would be low because actually the TSH would be increased by negative feedback mechanisms. And if you do the level of antibodies like TSH, those antibodies would be stimulatory antibodies, the level would be high. Okay, so now let us discuss about Graves disease in brief, and then we would be seeing about the various other image findings. Okay, most important finding which is also there in case of Graves disease is the ocular involvement, that is आंखों का involvement of the eye, and the classical presentation is exophthalmosis. Exophthalmosis is proptosis of the eyeball. The eyeballs are very much protuberant. You can see them coming out of the Hertel's line, which we call it. Okay. Now, there are other different signs. Okay. I won't go into the clinical signs of ocular graves, but let us discuss in brief and then come to the USG images. Graves disease. So, it is diffuse toxic goiter. It's an autoimmune disorder, important. There are special antibodies which are thyroid stimulating antibodies, and they just act like TSH. The structure is similar to TSH. So they act like TSH, and what do they do after binding to thyroid? They cause enlargement of thyroid gland with heterogeneously hypoechoic gland. Do you remember, this is same like Hashimoto? Even there the gland was enlarged, it becomes heterogeneous. Even there in acute phase the vascularity increased, the vascularity increases here too. But the only difference is that this is a hyperthyroid state. So remember, the imaging picture looks quite similar to that of Hashimoto. So when you are diagnosing it on ultrasound, we don't say whether this is Hashimoto's thyroiditis, or we don't tell that this is a Graves thyroiditis. We just say that this is thyroiditis. Simple. So now let us look at these images. So you can clearly see how enlarged this gland is. So you can see this is thyroid gland which is enlarged. What is the first important thing? The echogenicity. What is normal echogenicity of thyroid? Normally thyroid is hyperechoic. Here you compare it with muscle, it has almost become slightly hyperechoic to the muscle. So iso to slightly hyperechoic, that of muscle. Okay, and this is altered texture. Okay, the texture is altered. Now in B, if you see again here, the thyroid texture is altered, and you can see that the gland has become hypoechoic and heterogeneous, and the gland is heterogeneous. You can easily see that. Now once we put the color Doppler color box within this, you can clearly see for yourself that there is increased vascularity. So there is increase in vascularity. So very important finding in case whether it's a Graves disease acute phase or it's a case of Hashimoto, is that the gland become heterogeneous, hypoechoic, and there is increased vascularity. Okay. These are important findings for Graves disease. Okay. Now with this, you might find other findings, that is there might be signs of high output cardiac failure. Patient might have high output cardiac failure. So if the patient is a high output cardiac failure, you will notice pedal edema, dilated IVC, congested hepatosplenomegaly, all these signs. bilateral pleural effusion, pericardial effusion, okay, pulmonary edema. All these are the other radiological findings that can be seen in patients with Graves' disease. Okay, so I hope that clears up the entire concept of Graves' disease. So now, after Graves' disease, and another important pathology which I would like to discuss here is decurrent stenosynovitis. Decurrent stenosynovitis. So decurrent thyroiditis. Now, decurrent thyroiditis is a subacute granulomatous thyroiditis. Thyroiditis. Now, here the cause is different. The viral infection triggers this thyroiditis. So this is usually preceded by viral infections. एंड पोस्ट वायरल इन्फेक्शन. सो यूजुअली पेशेंट ऐसे आता है कि कुछ दिन पहले डॉक्टर साहब मुझे खांसी सर्दी हुई थी और अभी माय थायराइड ग्लैंड हैज एनलार्ज्ड, देयर इज अ मिड लाइन स्वेलिंग, बीच में स्वेलिंग आ गई है व्हिच मूव्स टू डिग्लूटिनेशन एंड दैट इज पेनफुल. सो दिस इज हाउ पेशेंट प्रेजेंट्स. So there is a history of viral infection. Okay, signs would of course be same like thyroiditis, but this history is very important. And the thyroid gland is painful. This is important. Now, initially when there is decurrence thyroiditis, there is hyperthyroidism because follicles rupture. And because of rupture of follicles, there is sudden release of the hormone. Hence T3, T4 rise. But later on, there is hypothyroid stage. So in later stage, there is hypothyroidism. If you see, the vascularity in later stage is decreased and the echogenicity is also decreased. So let us study the images of decurrence thyroiditis. So here you can see that this is thyroid, and you can see that there is focal area of ill-defined hypoechogenicity in the thyroid gland. Here also you can see that there are focal hypoechoic areas in thyroid gland. The vascularity in surrounding has increased, however in the hypoechoic area there is decreased vascularity. So that favors that this is a case of thyroiditis. Okay. So now let us conclude. Let us conclude this. Let us conclude our session of today. So here we have seen three important conditions. Number one, we have seen Hashimoto's thyroiditis. We have seen Hashimoto's thyroiditis. So Hashimoto's thyroiditis, very important. There is hypothyroidism. This is also autoimmune. Number two, we have seen again. What are the findings? Same. So you see muzzle-like gland. In acute phase, there is increased vascularity. Okay. Now, the second important we have seen is the Graves' disease. In case of Graves' disease, again there is stimulatory antibodies, TSH-like. So there is hyperthyroidism with ocular findings, and here again the gland is increased in size with increased vascularity. Third important thing which we have seen is decurrence thyroiditis. So in case of decurrence thyroiditis, you see ill-defined hypoechoic areas within the thyroid gland and patient becomes hypothyroid. Most important part is there is a history of viral infection. Okay, so we end here our session for today. Thank you. I advise you to send your comments and feedbacks in the comment boxes below. Thank you.